we are now going to look at the charities sector. This is one of the sectors that takes the bulk of the budget from the National Lotteries Commission allocation. As I have shared earlier, that on a financial year basis, you're looking at around 1.2, 1.5 billion. In the 2022-23 financial year, we have about 1.2 billion that will be distributed for good causes. The charities sector claims 47% of the total budget that will be allocated for funding. Now, the very first sub-program that the charities sector looks at is early childhood development, and that sector takes 35% of the 47% of the sector's budget.
So the overall goal of the ECD sector is that children under 7 fulfill their developmental potential through access to nutrition, basic quality childcare and education, as well as psychosocial support services and early enrichment opportunities. The reason that the NLC invests in the early childhood development sector is because we know that the first 1,000 days of a child's life are incredibly important. And if you make an investment in making sure that those early years are as well supported and the children are given access to all of these services, that has immense benefits in later life. The payoff for children throughout their life is hugely improved if we do interventions in the ECD sector.
Sarah, you will recall that the president made an announcement in one of the State of the Nation addresses where he clearly mentioned that the ECD will now move over to basic education. And it was historic on Friday the 1st when Minister Lindiwe Zulu announced the move towards the ECDs being now under the Education Department, Basic Education. The National Lotteries Commission is aware of those transitions, and we will engage with the relevant departments in order that we align ourselves with where the country is going in line with the ECD. And we'll make it public in terms of, the developments in that regard. But the funding outcomes for this program or this sub-program is to increase in the number of children accessing ECD services through centers that offer ECD services to children from low-income households. We envisage to improve quality of learning and teaching in ECD facilities. We also envisage to increase access to effective programs which ensure the development of positive social behavior. We also anticipate increase in fully registered ECDs and also the job creation retention in the ECD sector.
Yes, Sanele, as we all know, the ECD sector was particularly hard hit by the lockdown. So we feel that it's really important that our funding tries to rebuild that sector and make sure that these services are available for young children in whatever community they are living. Then in terms of measures to be supported, obviously we're going to continue with general support for the centers, which includes their operational costs as well as food and educational materials or toys, the provision of outdoor play equipment, skills development for both practitioners and support staff working at the center. And then this is a new area which we felt was important because of all of the impact of the lockdown and the difficult years that we've been through recently. And that is around psychosocial programs, both for practitioners to make sure that they are supported, as well as for children at the ECDs. And then lastly, meeting norms and standards for registration so that all of the centers we fund meet the regulated and prescribed standards that are available to make sure that there's even provision of service across communities in South Africa, that children have the same level and quality of service wherever they live.
The organizations that we expect that they will approach us with proposals for this subsector are registered and provisionally registered ECDs, crèches, as well as preschools. Now, I think we need to emphasize on this one, sir, especially the provisionally registered ECDs. That is why we've got an increase in fully registered centers as one of our outcomes, because we do accept provisionally registered ECDs. So if you've got an outstanding registration document, you still can qualify to access funding from the National Lotteries Commission, provided you have proof that you've started the registration process with the relevant department. So this needs to be clear, because people will keep asking as to, I don't have paper 1, 2, and 3. How do I access the funding? So provisionally registered can access the support from the National Lotteries Commission. Now, let's move over to sub-program 2, which is gender-based violence. This is still under the sector, Charities sector of the National Lotteries Commission. Now, we said 47% is allocated to the sector, and for this sub-program, 30% of the 47% goes to gender-based violence initiatives.
Unfortunately, South Africa still suffers from very high levels of gender-based violence. It's sad to say that we're probably one of the worst countries in the world where this still takes place, and women and girls' safety is not guaranteed on a daily basis. So we really feel quite passionate about supporting interventions in this sector. And you'll see that there are 2 goals in the program area. The first one is to focus on survivors, to make sure that they have access to prevention and response programs that are centered around a place of safety. And we want these programs to be integrated and comprehensive. And when you look at the measures to be supported, you'll see an explanation of what we mean by integrated and comprehensive. The second element of this program is around advocacy and policy interventions, because we know we're never going to tackle the problem of gender-based violence if we don't shift attitudes. So quite a strong component of this program will look at shifting social structures, norms, and practices that enable violence against women and children to take place in our society.
Our funding outcomes for this subsector is increased access to adequate and relevant support services for survivors. We want to increase public awareness and changing attitudes regarding violence against women and children.
And so the measures to be supported under this program will be the provision of safe house facilities for survivors, and those facilities must offer a range of programs which include psychosocial support services, whether it's through counseling or therapy, as well as access to healthcare or referrals to healthcare facilities. We want to see support groups being formed in those safe houses. We want the legal information advice to be available to survivors so that they can take legal advice that will help them in dealing with their problems. Opportunities to contribute to shelter life, which gives people a sense of meaning and being able to contribute so that they don't see themselves just as victims any longer. And then access to entrepreneurial training and skills development so that people, once they have reached a point where they've fully recovered from their experience, they can then move on into a normal life through having some kind of training and skills development opportunity. And then lastly, the advocacy and policy interventions, which relates to the goal we spoke about earlier around changing attitudes and norms.
The targeted organizations that can apply for this kind of support: non-profit organizations, non-profit companies, public benefit trust, with objectives aligned to the sector. Now remember that you were constituted for specific objectives. In your constitution, it should talk to the subsector and it should talk to the sector. If that is not the case, you cannot apply under this sector. The other program or sub-program that we are going to support in the financial year 2022-23 under Charities sector is protection of the vulnerable. Of the 47% of the sector, 35% goes to this subsector, protection of the vulnerable.
So let me start by just defining what we mean by vulnerable groups. So we have very clear definitions which are in our guidelines as well, but vulnerability includes children, youth, families, older persons, the homeless, as well as people with disabilities. And for these target groups, we would want to see integrated, community-based and/or residential wellness and support services, as well as, again, strengthen advocacy and policy interventions that focus on shifting norms and attitudes towards vulnerable groups.
The outcomes that we envisaged here is increased access to quality facilities, support services for listed vulnerable groups. We also envisage improved social, physical, and economic outcomes for residents, e.g., rehabilitation, independent living, improved health status as appropriate. So that is the envisaged outcome for this subsector.
And then the measures to be supported that will support the outcomes is social protection mechanisms that are linked to basic things like food, water, and shelter, as well as preventative and mental well-being approaches. So that could be things like life skill programs or assisting people with addiction or substance abuse, psychosocial support services through counseling and therapy, access to healthcare or referrals to healthcare, again, support groups, and opportunities to contribute meaningfully to the facility through things like helping in the garden or maintenance of the facility, and legal information and advice, diversion programs for youth in conflict with the law, and access to entrepreneurial training and skills development for the target groups that are being assisted. And then lastly, again, advocacy and policy interventions.
Now, what we envisage, the organizations that we envisage to apply for this kind of support would be registered NPOs providing services and care to the listed vulnerable groups. Note that some social and clinical services require separate registration with the relevant authorities. In other words, we expect that if you are providing these kinds of services, you must be registered with the relevant authorities to provide these services. We've seen a lot of organizations just submitting proposals to us, and yet they are not qualified to render those services. It becomes a bit of a problem for the National Lotteries Commission to support such initiatives. So you must be registered and be recognized by your relevant authority to provide these services.
And if you look at the guidelines, we've given very detailed information about all the different legislations, the different acts that govern the provision of those services. So that information is available for people if they're not sure exactly what they're supposed to do.
Sarah, do you want to take us through the additional thematic funding support areas?
Yes. So again, this is a new area in the funding program. And what we're saying here is that we've recognized that there are two critical things that we need to address as the National Lotteries Commission based on the research that we've done and the conditions which people are facing at the moment. The first one is food security. We know that because of the difficult economic circumstances that we're under and the decline in the economy that happened because of the lockdown and the various measures that had to be taken to contain the spread of the pandemic, that did have a very unfortunate effect on people's jobs, and with the result that we now have more people that are going to bed hungry every day in South Africa than we did previously. So to address this problem, what we would like to do is to offer a funding stream that looks at expanding or establishing some kind of gardening or micro farming initiative in your existing program area. So for example, if you're an early childhood development center and you want to start a food garden, we would then provide funding for you to be able to do that. But the important thing to remember is that it must be linked to or integrated with your existing initiative. So we can't just fund food gardens as a standalone, but we can fund them if they're part of your existing programs. And the idea here is that we would like to see the improved nutritional status of people that are the beneficiaries of those different programs through the funding or micro-agriculture initiatives. The second integrated measure that we're going to be supporting in this financial year is we want to see facilities that are more resilient to the effects of climate change. So for example, if you want to put in a renewable energy system into your facility, if you want to look at things like rainwater harvesting or solar installations that will, insulation that will improve the energy efficiency of your building, then this would also be considered. But again, it has to be linked to an existing program. It's not going to be standalone funding just for this. But if you would want to improve your facility so that it is more resilient to some of the climate changes that are happening, then we would also consider a funding stream for that area as well.